By 2040, 50% more people will have arthritis. That's around 25% of the population. But what can we attribute this to? Increasing population growth among certain demographics? Possibly. Regardless, over 60% of women over the age of 65 will develop a form of arthritis in their lifetime. These increases will place further undue burden on our healthcare resources and likely someone you know. Rheumatoid arthritis is likely to start in middle age, but young people seem to be getting it too. And strangely enough, it keeps skewing younger and younger. Why are we saying this? What is the cause of young people getting arthritis? And maybe the unique way or ways cannabis can regulate inflammation and control the immune response could be the key to all of this. One of the most common conditions for medical cannabis use is arthritis. The inflammation of a joint space due to injury, wear and tear, or the body attacking the joint itself. Pain, stiffness, nerve involvement, warmth, mobility issues. We know that genetics, environment, and autoimmunity is all involved. Studies have shown that the heritability of rheumatoid arthritis is around 60%, while the contribution of HLA heritability is around 11 to 37%. So while we see a genetic component to the severity of arthritis and whether or not you pass it on, the impact of genetics doesn't stop there. The most commonly used drugs for rheumatoid arthritis are called DMARDs. These are disease-modifying anti-rheumatic drugs, a class of drugs used to treat inflammatory conditions, connective tissue disorders, and even certain types of cancers. The way they work is both immunosuppressive and immunomodulatory. So they tell your immune system to stand down, or they tell it to look elsewhere for an enemy, generally speaking. So what's the issue here? There's a problem, and there's a solution, but there isn't. There are multiple genetic signatures that are associated with the response to DMARDs. What this means is that your genetics could disqualify you from a proper response to these medications. They might not work the right way, so what's tried and true might not be good for you. The side effects might not be so easy. They might keep you from a certain quality of life. Things like nausea, vomiting, rashes, eye and vision issues, fatigue, insomnia, and even bowel issues. So even if you are successfully able to use a DMARD, your genetics might influence the side effects. So why cannabis, and what does rheumatology think about cannabis? A friend? Current studies in patient-reported outcomes considers cannabis a friend to rheumatology, with 83% of patients reporting an improvement in pain, 66% reporting an increase in physical function, 66% reporting an increase in sleep quality, and other improvements associated with the use of CBD. If you're not aware, CBD is the non-intoxicating compound found in cannabis that can reduce inflammation, amongst other things. Here's why. Cannabinoids like CBD are shown to affect our cyclooxygenase pathways 1 and 2. So they work similar to the way NSAIDs work. You might know NSAIDs by other names like Aleve and Advil. So CBD reduces pain in a similar way, but it also strikes at the root cause of things like rheumatoid arthritis. Several studies have identified the importance of the receptors for CBD as it relates to the immune system. CB2 receptors, the receptors for CBD, can change the way that immune cells are produced, the way immune cells travel, and the way immune cells behave. That includes the way inflammatory cells will move and behave with respect to your joints. But a lot of people with rheumatoid arthritis are already using or have tried cannabis in the past. One of the problems is that most people with RA are dealing with other issues. We call these comorbidities. And comorbidities require using medications, and these medications could impact the way that cannabis works on the human body. Also, many of these autoimmune issues run in groups. If you have a risk of one, you might have a risk of another. And these might have medications that could interfere with cannabis because they affect your liver. The liver is where cannabis, especially edible cannabis and ingestible oils, are metabolized. Not just THC, but also CBD. But the most commonly prescribed DMARDs like methotrexate, luflanomide, and sulfasalazine can put a lot of undue stress on your liver. In doing this, it can lower the effect of your meds, lower the effect of cannabis, hurt your liver, or all of the above. So if a proper guide isn't there to consider your disease, consider your medications, consider your history with cannabis, you could be doing more harm than good. This is one of the reasons cannabis for arthritis might not be working for you, aside from cannabis itself being the problem. And it might be. There are recent studies that show the way you're using cannabis might make your arthritis worse. While most cannabinoids have anti-inflammatory effects because of the way it affects your CB2 receptors, there are some that affect mainly CB1. And recent studies have shown that activating these CB1 receptors can be pro-inflammatory. You heard that correctly. So certain types of cannabis could make your rheumatoid arthritis worse. But conversely, there are some CB1 antagonists that could make your arthritis symptoms go away. But it's going to take someone who knows the pharmacology of cannabis and its cannabinoids deeply to guide you to an optimized treatment plan. There are so many different variables out there, including CBC, CBG, CBN, and a host of other cannabinoids. This goes way deeper than THC and CBD, and any of these could be the missing piece for you. For instance, CBC has been shown to decrease inflammation, and a cannabinoid like CBG is even known to cause repair of bone tissue. And this one decreases inflammation as well. So why hasn't it worked for you? Genetics dictating the severity of your disease? Your medications? The medication side effects? The way you use cannabis? Or maybe something else? This is not an easy answer. To treat arthritis effectively with cannabis, you need to consider your unique, personal scenarios. All of these are pieces of a larger puzzle. Using cannabis for conditions is not necessarily a mathematical formula, because people are not vending machines. Every person has unique attributes and they need to be explored for proper treatment. So when it comes to cannabis and arthritis, take one marijuana daily doesn't cut it, and it never did. DeMonet is a personalized education platform honoring the rich scientific and medical history of cannabis, while catering to the present and future of plant wellness. What we do is we paint a picture for you to bring the complexities of plant wellness into focus. Hey everyone, if you liked what you saw, there's more videos available and more information right here.